So, in this little mini lecture, I want to walk you through social support and try to tie together the different learning assignments that I've provided to help you understand why social support can help to reduce stress. So, first, let's look at the health benefits of better social support. We see there's quite a bit of research to show that people with better social support live longer, they have better mental health, better physical health, and even we see a slower disease progression among those who might have chronic illnesses but good social support. So the question you should be asking yourself is why? Why does this happen? So we're going to be walking through different aspects of social support that might describe this. So now let's walk through the different types of social support or different types of coping mechanisms and map them onto social support. And you've talked about lots of different coping mechanisms from your textbook and from the Cohen and McKay seminal article that was assigned for this topic. So first, let's consider emotion-focused coping. We know that in terms of social support, you could go and speak with somebody, and this could help with reframing, reappraisal, or acceptance just by talking through the problem. Cohen and McKay broke this down into appraisal and emotional support, with their appraisal support being described as psychological support contributing to one's body of knowledge of cognitive system. Social support can help with properly appraising the situation and figuring out your ability to cope. So might be these little suggestions that somebody can make that can help you with that appraisal. Social support might result in focusing more on a positive thing. So, for example, you may have had a horrible experience and you're feeling really bad about it and about yourself, but a friend comes to your rescue and really helps you just by dropping everything that they were doing so they can help you and talk to you. And this could be very encouraging, where you sort of reframe it and say, yes, that was horrible. It still is horrible. It felt horrible. But look at this amazing friend who would do this amazing thing for me. And that positive feeling could really help counter this stressor. And then finally, emotional support. When Cohen and McKay was talking about it, they highlighted specifically how this is psychological support that's meeting one's basic socio-emotional needs. So it's related to maintaining your feelings of control and self-esteem. So that's where we see how social support can really help with these psychological issues. Next, let's talk about invisible support that was discussed in your textbook. So how do we see social support with invisible support? And this is that idea that there's a safety net that you feel that you have even if you don't use it. So this can be very helpful in a time of comfort. So I've put these pictures of loved ones. You may look around your dorm room or your apartment and see that you have put up reminders of invisible support. These are people that you may not see often. They may no longer be alive even. You may not talk to them that much, yet they are very comforting to you, and that you feel like they're constantly supporting you. And that can be a very helpful aspect of social support through invisible support. Next, I want to talk about problem-focused coping, and we know that this is a very effective means in reducing stressors by targeting the specific stressor itself. So this could be getting together with friends to help you study. That's how we can see social support aiding in problem-focused coping. Cohen and McKay called this tangible support. And so these are non-psychological or provision of material aid. So think about how your social support network can help you with very specific tangible things. So this could be providing you social contacts or networks. If your social support, if you need to find a new job, and a friend of a friend is able to connect you with something like that. or you're looking for an internship, you are struggling in a class and need to find somebody who's taken the class before and maybe get their notes. And this is where your social support can provide that very tangible support. Now, something that Cohen and McKay discussed in their article that I really want you to consider is that we need to be sure that this is most effective when it's viewed as appropriate by the recipient. So if somebody is offering through social support, tangible support, but it is threatening that person's sense of control, making them feel like they have a loss of freedom, it's making them feel as if they're being viewed as inadequate or feel like they're in debt to somebody, then this would not be an appropriate method and can actually, it wouldn't help a stressor and it could increase stress. Another concept I want you to think about in terms of social support is avoidance coping. Now, we know avoidance coping is not effective in the long term, but it can be effective in the short term. As many of you can probably relay, your life is very stressful. You have lots of stressors going on. You're never going to completely mitigate these stressors, but you can sort of just shut off for a little bit. So maybe tell yourself, Friday night, I'm going out with friends, or I'm going to commit to going to exercise with a friend twice a week, no matter what I'm having to do, because I need this time to really just shut it down for a little bit and just focus on this social engagement instead of thinking about all these stressors in my life. And then finally, the last thing I want you to consider in terms of how social support aids in coping is related to what you will view when you watch the documentary Happy. And this is how social support can help with stress by providing laughter. It can provide a physiological response, a dopamine fix that can lower the body's stress reaction. So I want to sort of apply something else that we saw in the Cohen and McKay article, and that's the role of social comparison. So if you're considering about the research that you read and how health psychologists might use it, you could think about how health psychologists might plan support groups. So they knowing that social support helps with stress, they might want to get a group of similar people together to talk about that stress, and hopefully that would help them to reduce their physiological response to it. Now, let's think about three things that that Cohen and McKay said. One, people prefer to compare themselves to those who are worse off to reduce their appraisal threat. People are more likely to seek and be receptive to support from people who are similar to themselves. And they talked about upward comparisons. They can be distressing or destructive, that they make someone feel like they're not doing as well as someone else. So taking these things together with social support groups, we need to consider that yes, people would want to be around other people who are similar to them, but at the same time, it could be very distressing if they're looking at other people and saying, hey, these people are doing a lot better. So here I've provided two pictures that I found. Both are for Parkinson's patients. So we know that Parkinson's is a neurological disease that has gradual deterioration, and usually there's about a 10 or 15 year lifespan after diagnosis. Now on the left, you see what you might typically see as a support group where you're just meeting in a room and hanging out. And this might be distressing to some people because they might go into this and either look around and say, oh, hey, people are doing a lot better than me, and reappraise their situation as more stressful, or even just be reminded in this situation that they're looking at people who aren't doing very well and being reminded that this is where I'm going to be. Now, an alternative to that is the picture on the right. And this, I think, is a really ingenious social support group that it's been developed around boxing. And so they get Parkinson's patients together. And this, you can see, it's not just emotion-focused coping, it's problem-focused coping. So a really ingenious way the health psychologist could design something that they are meeting other people that are like them, but boxing has many elements where it helps with, it's basically physical therapy for their Parkinson's disease. So they have issues with balance, and this helps them to practice balance, issues with reaction, connection timing. So just a really great way where they have people who are similar to themselves in that, yes, they have a disease, but they're not letting that disease get them down. And hopefully they could see some people who, even in with their disease having progressed, they're still able to be a part of this group and they're still really fighting. So I wanted to give this as an example to just sort of think about that in your role in your career. If you have to try to improve social support for people to counter stress, what are some ways that you need to consider how social comparison could either help or harm this process? So I want to talk about two models of social support. And this is from another seminal article that Cohen and a different article co-author Wills published a year after the article that you read. And this may help you to see how certain analyses can be applied to the research that we do on social support. But even if you don't have much of a statistical background, I hope this also helps you to see a different way that stress might counter social support. So first, let's discuss the main effect approach. So we're talking about a main effect. That is a statistical analysis that you may have seen, an analysis of covariance. And if you graph this, then you see some nice parallel lines. So let's just break down the graph A, where we see for people who are at low stress, if they have low social support, they have slightly higher symptoms. And we see these absolutely parallel. So they have the same slope, that as their stress increases, we also see their symptoms increasing, but regardless, this high social support group, they maintain lower symptomatology. Now, what we're going to discuss predominantly this week is the buffering effect. So when we talk about the buffering effect, those are graphs B and C. And first I want to walk you through graph B. This shows how it provides protection against stress. In this graph we see another relation where low levels of stress, people have the same amount of symptoms. So regardless for if they're low or high social support, at low levels of stress they have the same amount of symptoms. But the slope is much steeper for those who have low social support. So again, like our main effect, we see that social support, it doesn't completely mitigate the impact of stress. People with higher stress, we still see more symptoms, but it lessens it. And in this graph, we can say it lessens it or it buffers it. This is also called an interaction, which you may have learned about when you were learning about analysis of covariance or running regressions. So let's talk about one more interaction that could also demonstrate a buffering effect. But this is sort of the ideal situation because you see no change in the high social support group. This means that their slope is flat compared to the black line in graph B. This would be ideal. This means social support completely mitigates the impact of stress on symptoms. As we move forward, consider graphs B and C when you're thinking about the buffering impact of social support. In most cases, we're just going to see social support reduces stress impact on symptoms, but we could see in some cases more graph C where it totally eliminates it. Just a reminder, this is also called an interaction. Now, the definition of interaction is when you have a third variable that changes the relationship between the other two variables. So in this case, what I've been describing is the third variable is social support, and that changes the relationships based on whether you're low or high between stress and health symptoms. Now let me show you why this is so important for us to consider these third variables in health psychology. So if you look at this graph that I made, and if I asked you, this is made up data, but I've given you the perceived stress questionnaire, and I also gave you a health outcomes questionnaire on your Qualtrics survey. And what if we looked at the correlation between these two? And here we see there's no relation. So if you looked at the correlation, that would probably be pretty near zero. They're just a random scattering of dots. So people who have higher perceived stress, we can't really say they have higher health outcomes. People who have lower perceived stress, it doesn't look like they have any lower health outcomes. So there's no true pattern emerging. This is the exact same dot configuration, the exact same pattern. But what I've done is I've highlighted it and I've shown you, so what if the dots in red show those people with lower social support and the dots in blue show those people with higher social support? In this case, we see there is a really nice correlation. So we see a relatively steep correlation for those with low social support. And compared to those with high social support, we see a much less gradual correlation. This is a perfect example. If I would have run an analysis on the first graph, I would have said there's no relationship, there's no correlation, so perceived stress doesn't impact health outcomes. And I would have moved on and I would have been wrong. If I looked at that third variable that broke up the different participants into the two groups of low versus high social support, this is where I see that actually, yes, perceived stress does impact health outcomes, but it's really more important for those who have low social support. We're seeing poor health outcomes the greater your perceived stress if you don't have good social support. So moving on, let's consider a different type of social support. Let's consider how we could break up social support into structure and function. When we talk about structure, this is the existence of a relationship for social support. This is a very indirect or proxy approach to measuring social support. This is literally if I asked you if you could count up how many friends you have, or if I asked you if you were or were not in a relationship. So it's just providing me a number, but it's not necessarily telling me about a quantity. So let's look at functional support. Functional support is probably a better measure, and this is when we're seeing how social support directly serves a function. So this could be if your stressor is you need money and social support provides you a way, a loan or some kind of discount. Social support providing emotional support, knowledge, a social outlet. So are we seeing this map on to those different coping mechanisms we talked about a few slides back? Now, something to notice is that there's a really low correlation between structure and function. So we can see that that's why structure isn't a very good proxy for social support. And this was discussed in your Cohen and McKay article when they were saying, well, there's been some inconsistency in the research between social support related to stress. And they were proposing this might be because of the operational definition. So remember back to chapter 2, your operational definition is how you define what a variable is. So in terms of social support, if you just broadly say social support instead of specifying social support in terms of function or social support in terms of structure, then you might be comparing apples and oranges, and that could lead to this inconsistency. So this is very important for research when you're measuring, you're choosing what measure you want to use, but also for application for those of you who are trying to help someone to counter their stress. What specific function do they need? Adding more people to their lives may not be helpful if it does not help to counter some of the stressors that they're dealing with. So remember back to graph A, when I'm talking about function, that is typically seen, when I'm talking about structure, so the number of people in your social support network, that is typically seen in a main effects model, those parallel lines, where we see that there's actually a sort of a threshold. For many people, they don't need a ton of people in their lives. They just need quality over quantity. So, for example, if we look at social support and longevity, we see that people, this is a graph that was presented in your book, that people with more social ties are going to live longer. But let's sort of break this down. I'm sure you can think of a person in late adulthood. And what if they listed all their friends and family and they have tons of friends and family, but they need somebody who can take them to the doctor on a Tuesday or help them go to the grocery store? They need somebody who can help them so that they don't have to go into assisted living. Those are specific functions where they may have a lot of people in their address book. They have a lot of structure, but they're not serving the important function. Same thing, I want to remind you in the survey that I gave you a question about social support that was related to structure when I asked you if you were in a relationship or not. So for some people who answered yes, I'm in a relationship, I'm married, or I'm dating somebody, that may not be helping with their stressors. In fact, for some people, it could be increasing their stress if that structure is not matching specific function. Alternatively, we could have a lot of people who identified that they were single but are doing quite well in social support, and just looking at their relationship status, that's not a good indicator of the functional support that they're provided. So this is something you could think about when you are doing your module write-up. So let's end and focus on this buffering effect, which is more evident when you look at the function of social support instead of the structure. So let's look at just the pure definition of buffering. That's to lessen or moderate the impact of something. So synonyms, you can think of shielding, protecting, defending, cushioning, insulating, screening, or guarding. So in this manner, how does stress lead to health consequences? And we see the buffering effect is literally sort of putting up a wall that either lessens it or completely mitigates the effect. So when we think about, another way to think about it is that social support from the buffering model, it's helping to balance out or counter the load of a stressor. Now, this is what we saw in Chapter 4 with Lazarus and Folksman's transactional model of stress. And here's what I found. This is actually cut from their seminal 1966 article. And this is just a prettier version of that, a summary showing that there are two time points in that temporal aspect of buffering in which social support could change that pathway between stress events and health consequences. So either social support could change it with a stress event leading to a stress response by talking to somebody, problem-focused coping, but cutting it off early on. Or if the stress event does lead to a stress response, it could help to mitigate that stress response turning into a health consequence by changing this pathway. So you are in some way the functional support of social support is making it where you reframe things or take another attitude. You enact in some type of coping mechanism that shuts off this negative progression. So let's end tying this back with the happy video again. In the happy video, they present some research where there were women who support children with severe developmental disabilities. They age at a rate of 6 years per calendar year, and this was explained by telomere shortening. But research shows that these women who were in this social support, and think back to social comparison, they were with a group of women that were all dealing with the same things. All of these women had a child with severe developmental disability, and it helped to lessen this effect and even improved in some cases. So this matches what we know from Cohen and McKay's article. We can think about sort of mapping this onto structure and function, how for these women, it's not the structure so much. Yes, it's great if they have supportive husbands, if they have their parents that might help out, or friends and family, but really it's not the number, it's the function. Do they have people who can help them with childcare, who can help them emotionally, financially, if they need to take away time from work? And this also fit an overarching message from Cohen and McKay that the shoe must fit. A great example was a mother was in tears discussing how a friend was telling her that she needed to put her daughter in a group home. So think about it from the friend's perspective. The friend was suggesting a problem-focused coping mechanism, that to reduce the mother's stressor would probably be better if she put her child in a home so that she didn't have as much responsibilities. But that's not what the mother needed. That was a very poor fit, and it was quite distressing to her. She didn't need problem focused coping, she just needed somebody to talk through the situations to try to work on that acceptance, reappraisal, reframing. So, when you think about social support and how it counters stress, consider if the shoe fits. Is social support providing what is needed functionally to counter the stress? To help with reappraisal, by talking with a friend and using coping, or calling up your parents to see if you can borrow their car for a week when you're just in the shop. That'd be problem focused coping. Having a friend who will pull an all-nighter with you to study for an exam, or a friend that will go grab coffee with you so you can escape studying for just a little bit. Or that significant other who makes you laugh to increase your dopamine and provide that physiological counter. I hope all of this helps you to think about social support in a different way and how it has such a critical aspect in health psychology between stressors leading to poor health outcomes.